skull, that's also shown. There's also vertebral that's shown here, but on that model, but I can't really see it too well here. Usually what I do for blood vessels like this, on this model, I may take a string and I may tie it to it. Look for strings tied to the models. Look on the inside of the skull to study some of the circle of Willis. You can see some of the things here. Where the artery comes in, that's the internal carotid. Okay. The other artery that comes in the skull, these two, the vertebral, they form one basilar artery. And then the basilar artery will branch into these two posterior cerebral arteries. They give a branch that goes forward. It's the posterior communicating. Okay, posterior communicating. Okay, so this ICA, the internal carotid, will give this branch that goes forward. Those are the anterior cerebrals, and they communicate right here, the anterior communicating. After that branch point right there, we call it the middle cerebral artery. Okay, number 7 there. So that's all I see there. Look for ophthalmic too. I think they do show it to you. I see one little artery going in right there. Ophthalmic artery. This model also shows, well, it mostly only shows this. I mean, these two are the vertebrals, making that what? Basilar arteries. And these two branches would be the posterior cerebral arteries. But this little nub will be the posterior communicating. I can ask any of that. But look for other structures on here too. I just can't see them from this picture, but other circle Willis stuff is there too. Now, this model, I usually only ask it to identify the middle meningeal, usually. So that's the one I like to test on with that model. There's a half head that has models on the inside of the skull. Students kind of forget to look here. But it does show the superior sagittal sinus, and it shows the straight sinus, which merge to form the confluence of sinuses. So those are there. You may not know it because I didn't present it this way, but this is the anterior cerebral artery. Okay, so I can ask you that too. It's the anterior cerebral artery. So here's the other side of the half head. It shows you some external vessels of the skull. There is the external jugular. Okay, that's the internal jugular. And anterior jugular is also right there. So the 3 jugulars that you're supposed to know are there. The facial artery and vein are right there. And that's all I see in terms of blood vessels. Oh wait, these two. Superficial temporal artery and vein. And back here is occipital artery and vein. Okay. So once again, let's see the 3 jugulars. Which one is that? External. Which one is that? Internal. And anterior. If that's the internal jugular vein, if I tag that, what would you put? It's the carotid, common carotid artery. So again, facial artery and vein, superficial temporal artery and vein, and occipital artery and vein are also there. That's all I would ask you for that one. So this one, I would study all the sinuses that we went over on this one. I just can't show them all to you. I might ask you to identify this septum. It's the falx.
Cerebelli.
What's the full name? Yeah. Falx cerebri. Okay. The other one that you have to know, this is falx cerebri. This is tentorium cerebelli. Okay. And what's that? The blue thing. Superior sagittal sinus, inferior sagittal sinus. You can see a little nub of great cerebral vein. It's kind of blurred out there, but that's the straight sinus. They're going to merge to form the confluence of sinuses back here. But that one, what do you call that? Transverse sinus. There's also sigmoid sinus, so look for it in other models. So this one here that I went over, it's labels on, labels off for you. So you can study it. And this one too. Labels on, labels off. There are the labels you can study. And these are all on the slide. I don't know if you looked at them. Sometimes they give you things and you don't know they're there. And don't let them hide from you, they'll help you. Okay, so just study labels on, labels off. So this one, we also have the labels on, labels off. Just to go through it, I like this muscle. It's our landmark muscle, anterior scalene. So behind it is the artery. Subclavian artery, subclavian vein, IJV, internal jugular vein, brachiocephalic vein on the right, brachiocephalic vein on the left, superior vena cava, pulmonary trunk. Here's the aorta right there. Here's our three branches. So the brachiocephalic trunk is that one, and left common carotid, left subclavian, and we see the subclavians on the other side too. So in the lung, we have pulmonary arteries and pulmonary veins. What color are the pulmonary veins in pulmonary circulation? Pulmonary veins are red. They carry oxygenated blood. Very good. Here's that model with the labels on there, and you can check that out. Here's our circulatory board. I'm sorry, this is the next slide. Okay, this slide, I'm just going to ask you this one. Internal thoracic artery. It flanks the sternum. Remember, this is a branch of subclavian. Okay. So the circulatory board is a close-up picture. Again, just to review the blood vessels really quick. The big vein, internal jugular vein, emerges with the subclavians. They form the brachiocephalics. For brachiocephalic, notice how the right one and the left one are really different. If I ask you to identify the left one, you better put left, brachiocephalic vein. I usually don't have you put left or right, but for when it looks different from the one on the other side, it's good that you do that. Well, they merge to form superior vena cava. Which artery is that? Pulmonary trunk. And here's the aorta. If I say identify, be specific, you know there are different parts of the aorta, right? So if I put it like way down here, what part would you put it? Ascending. If I put it right here, put the arch, aortic arch, and keep ascending. Okay, well, if you follow the subclavian, it's going to become axillary, but they do show some branches, thyrocervical trunk and vertebral. Okay, vertebral, thyrocervical trunk. I'm not sure what that branch is. I'm not going to ask you that. So right around here, if I want to do axillary artery, I'll put it around the head of the humerus because that's where you're in the artery region. And they do show you our three branches: anterior, posterior, circumflex humeral, and the third branch is the subscapular artery, and they have it on the other side as well. Anterior, posterior, circumflex humeral, and subscapular. So what I don't like is, and the anterior one should go in front of it, but they don't model it that way. But that is anterior, that's posterior, and that's subscapular on both sides like that. Okay. So again, identify. Subclavian, what's that? Axillary artery, and there's the vein. If this is the axillary vein, look at this that's draining into it. It lies in the deltopectoral groove. Cephalic vein. Cephalic vein draining into axillary vein. Okay, and then it becomes subclavian, and then brachiocephalic, and superior vena cava. So I labeled those two on that one, but it's fully labeled here, so you can kind of just drill yourself to death. There you go, and then labels on. This one's the lower extremity stuff, and since there's labels on, labels off, you can just study yourself. But let's study with the labels on. That little nut, deep femoral, that's mostly femoral. But let's remember that it disappears, and it's going to go through the aortic hiatus. When it's behind the knee, call it popliteal. That branch is its termination. The one going to the front, anterior tibial. But you know what? I like to label anterior tibial on the other side. on the right leg. Do you see it? Here's the anterior tibial on this side. See that red line? If I tag that one on this model, it will be on the other side. Posterior tibial is behind the tibia. So notice that the leg is kind of curved to the side so you can see the lateral view. So this foot, you see the front. This is the great saphenous vein. I could label it there. I could label it down here. I could label it up there. It's the longest vein of the body. It's the great saphenous vein, commonly mistaken by students as the femoral vein. Okay, it's like you just want to call anything in the leg femoral vein if you haven't studied it pretty well. I don't know why they like to do that. There's also small saphenous vein right there. Let's see here. No, it's kind of blurry, sorry about that. But study the great vessels of the heart on this model too. I went over it a million times. On this model, it's these two that merge to form brachiocephalic. Internal jugular and subclavian veins form the brachiocephalic veins. Is that left or right? Left. I don't know why I like that vessel so much. I just do. Study the arteries behind. It's too blurry. I don't want to teach from it. It's making my eyes go funny. Here's the inside of the pelvis. Now, when we looked at this before, okay, I'd always start by looking for your landmark, the ureter. You see the ureter. Okay, I'll point to it. Once I find that, I'm good. I can identify that before the ureter. It's common iliac artery, and after the landmark, it's external iliac artery with the vein. If that's external iliac, and what's that? Yeah, very good. Now the internal iliac had a lot of branches you had to know. Let's go over the ones that I see here. I see part of the posterior division, superior and inferior gluteal arteries. I see this one. It's leaving, going through the obturator canal. It's obturator artery. Now, the white thing is the nerve. I'm not going to touch on the nerve. It's the obturator artery. That's going to be umbilical. And the one leaving there is internal pudendal. So let's do those again. Superior, inferior gluteal arteries, internal pudendal, obturator, and umbilical. Okay, that's pretty good for that one. On this one, can't really see anything. I just like to do the, maybe the gonad. Well, you can see some things. I mean, if you see blood vessels going to a gonad, just call them gonadal artery or vein. I don't think that's on your study guide. Might be. Okay, this right here, here's my landmark. That's the ureter. So what does it make that? External iliac artery and vein. So before my landmark, what does it make that? Internal iliac and common iliac. That's all I see for that. We study this for repro, but just know those iliac arteries. This one kind of looks like that, and it's labeled for you, so you can review that on your own. Remember to study your fetal circulation. I taught you 3 bypasses. One is a bypass, you go from atrium to atrium. What's the name of the hole when it's open? Foramen ovale. And when it's closed, fossa ovalis. There's an artery that's open here. It's a duct between this artery and this artery. Ductus arteriosus, when it's open, when it's closed, ligamentum arteriosum. The other bypass is a bypass of the liver right here. When it's open, it's a vein, because remember, what is this? Umbilical vein, ductus venosus, or ligamentum venosum when it's closed. You have 2 of these umbilical arteries and 1 umbilical vein. Okay. So, there's that. Here's a slide showing you the superior rectal artery. See the blue arrow? So I could label it anywhere along here. As long as you see that it's going to the rectum from a superior vantage point, then you're good. This one I already went over and I keyed it out for you. It's more of the branches of the internal iliac. So just Just study that slide. It's a little different than the other ones, so do take a look. Remember, don't mess up the iliacs. As long as you find your landmark, I might even have you identify the landmark. Don't let that surprise you. What is that? That's the ureter. That's a fair question. Here's a picture of the lower limb. Not much as far as blood vessels. Here's our femoral nerve artery and vein. Just don't mix up the colors. The name's the same. What's yellow? Nerve. What's blue? Vein, and the red is the artery. So the red is the popliteal artery, okay, and the blue is the popliteal vein. I won't test you on the nerves, although I did teach them. Nerves was 4th group. Okay, this. See, it's on the anterior part of the tibia. Anterior tibial artery. Okay. So notice how I had to remove a muscle to see it. So don't let it hide from you. Be sure to remove that anterior tibialis muscle so you can see the artery underneath it. All right, what's this? Lies in the deltopectoral groove. Cephalic vein. You can't see some of the great vessels of the heart. Here's my 3 branches of the aortic arch. Can you tell me now, what's the first one? Brachiocephalic trunk. Very good. Then left common carotid, left subclavian. Very good. Which part of the aorta is that? Descending. You can put descending aorta or thoracic aorta. Very good. What's that? That's the aortic arch. Okay. So, you know, the aorta has many different names. All the arteries have many different names. Tends to drive you crazy. This is the one from the lecture where I divide it subclavian, axillary, and brachial, so you know where to look. How did I know to put this black line between axillary and brachial? What did I look for? There's no landmark there. The landmark is the teres major. I just said, oh, those are the branches of the 3rd part, so after it must be brachial. That's all I did. You need to know the brachial artery too. Here is the vascular arm. And there are 3 vessels you have to know that are in my hand here. If that's the thumb, that should be cephalic. The one on the other side, starting with this big one, is basilic. And the one that connects the two, the median cubital vein. That's the one they do blood draw from. It's in the crook of the elbow. So if you lift them up, you can see the deeper vessels. If that's the radius bone, then you've got 1 radial artery. Notice how they model 2 radial veins. You have multiple radial veins. Okay. Here's the ulnar artery. Therefore, the blue things must be ulnar veins. Very good. So before they branch, what are you going to call it? Brachial artery. Very good. Remember, it branches about 1 inch past the ACF. So you see brachial veins there too. So I kind of did a close-up of the proximal part. So the big one is the basilic, okay, the more superficial one. So the red one, what do you call that? Brachial artery. So if it's the small blue one, what are you going to call it? Brachial vein. Basilic, brachial artery, brachial vein. Okay, here you can see the cephalic draining into the axillary. So up here, it's axillary artery and vein. Down here, it's brachial artery and vein. That big one is the basilic. Okay. You also see, hard to see, but look for the loop around the surgical neck. 2 arteries, this one and this one. Is this one anterior or posterior? Yes, so it's the anterior circumflex humeral, so what is that one? Posterior circumflex humeral. That's all I see there. Let's move on. Here's the other muscled arm. The only ones I choose from here is brachial. And then you can't see them, I gotta remove those muscles. But if I tag an artery on this side, what are you gonna call it? Radial artery. Remember, thumb side is radial rad. Ulnar artery. That's all I tag on that one. So just 3 for that, and done with that one. And that's it. Woo-hoo.